Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I am your host, Samuel. And today we have with us another special guest who goes by the name Holly Frankenberg. Now, what makes Holly unique is that she was a customer service rep for the medical technology company she works for before she became a clinical specialist with that same company, which of course gives her a really thorough understanding of the role she eventually stepped into. This interview is really going to go in depth on what it means to be an associate sales rep versus a sales rep versus a clinical specialist in the medical device sales space. You know, I get those questions a lot when it comes to medical device sales, and this interview is really going to give you some insight. As always, we do our best to bring you guests that have this kind of insight, that bring innovation, and bring different perspectives to the medical sales industry. Thank you for listening to the Medical Sales Podcast, and I really do hope you enjoy this interview. Hey, Holly, how are we doing today?
I am doing good, thanks. Thanks for having me.
Definitely. Glad to have you on the show. So why don't you tell everybody who you are and what you do?
Yeah, absolutely. So my name is Holly Frankenberg. I am a clinical specialist with Medtronic's Pain Therapies in the Hudson Valley, which is upstate New York. And I've been with Medtronic about 6.5 years. In the field, about a year and a half.
Okay. Oh, wait. So you've been with Medtronic for 6 years, but only in the field for about a year and a half. What were you doing for the previous 4.5 years?
Yeah. So right out of college, I got an entry-level position with their customer service or inside sales team, fielding phone calls, processing orders, that kind of thing. And I really got a good sense of how a med tech company operates kind of from the inside in a low pressure setting. And then I moved on to being a contract analyst for our spine therapies. So kind of more like overarching strategies and more like, 10,000 foot level versus the day-to-day kind of operations of what customer service was doing. So got some good experience there. And then I've been out in upstate New York for the past year and a half as a clinical specialist out in the field.
So that's a pretty unique introduction to becoming a clinical specialist. You said, so you started off as a customer service representative. Tell us a little bit about what that role is like. What exactly were you doing?
Yeah, so it was in-house, just basically supporting our field employees as well as our customers and patients. So whoever would call that 1-800 Medtronic number and however they needed help, you would assist them. So whether it was like our employees, like our field employees, we'd help them with either, tracking issues, billing issues, that kind of thing, or returns. Like a lot of customers would call in returns. If there was patient issues with their devices, we'd field them to the right team. So with a lot of just more the day-to-day kind of operations of a med tech company. Mm-hmm. And then that's kind of how I got exposure to the clinical specialist therapy or the clinical specialist position, because a lot of clinical specialists would call in and I would think to myself, what's the difference between a clinical specialist and a sales rep? Like I knew they both were in the field in some capacity. Mm-hmm. So then that's kind of what sparked my interest to pursue that position.
Wow. So when you were a customer service rep, did you always want to be in sales, or did you not even, it wasn't even on your mind?
So sales was kind of always in my mind. So before coming to Medtronic, I was a nursing assistant at an outpatient orthopedic surgery center where I got my first glimpse into med tech and just thought it was a really exciting industry, an exciting role to just kind of be in the field and kind of have autonomy over your day, as well as kind of just triaging, and every day is different. Right. And I just thought it was a really exciting position. So that's kind of where I got my first exposure, and then seeing and interacting with clinical specialists from the inside. I would connect with them, do field ride-alongs. I mean, everyone I talked to was very helpful about, informational interviews, ride-alongs, that kind of thing, and helping me develop on my career path.
So you went from college to nursing assistant, found out about Medtronic, and then said, you know what, I want to try my hand at customer service, and the rest is
Absolutely.
history. Wow, that's a
Absolutely.
cool career track. Cool career track. So would you say that? I mean, I'm assuming a hard yes, but let me hear it from you. Would you say that having all that experience with customer service has just given you a leg up in understanding how to be a best asset in the role of a clinical specialist?
Absolutely. Absolutely. I mean, it built such a solid foundation on what all the internal departments do to support the field. And, I joke with people on my team that if there's an email where you have no idea what supply chain is asking you for or what contract is asking you for or
Yeah,
finance, I'm kind of the translator for what information they need from us. So it really
that's
helped.
cool.
Like it was a great low pressure setting to really build that foundation where I can now utilize those translational skills in the field.
That is fantastic. Okay, so a lot of our listeners are completely naive to the industry. They don't know the details. And you're a clinical specialist, which is not a sales rep, which is not an associate sales rep. So I would love for you to kind of color us in, talk to us about each role. What is a clinical specialist? And then after you tell us that, give us the other two. But first, what is a clinical specialist? What is their defined role with Medtronic?
Yeah. So the way it's set up with Medtronic and with our pain therapies is the clinical specialist is really kind of the first person to cover those clinical needs, right? So trials, implants, patient meetings, that kind of thing. So we're really kind of the first line of defense or the first kind of person deployed to cover those, day-to-day type clinical activities to try and free up more of our sales reps and our associate sales reps time to focus on building new business or maintaining current business or focusing on just, the sales activities that are important to our team overall. So the clinical specialist is more so kind of the day-to-day clinical, I guess, the clinical resource. And then the sales rep and associate sales rep, they're held to a number. They're the ones that are, steering the ship, and I go where I'm needed, and they find new business. They meet with new patients, do all that kind of stuff. So to kind of
So,
grow the
so
business.
walk us through what that looks like. So let's say I'm customer X. Who am I talking to first? You, the sales rep, or the associate sales rep? Well, yeah. I'll let you
Yeah,
answer
I'd say if you're, brand new to us and to either pain therapies or spinal cord stimulators or targeted drug delivery, I'd say you're probably talking to my sales rep first, just to kind of establish that relationship, find out what the needs are from the customer, as well as how we can best fit for their needs. And then once we've kind of developed a relationship, we have a couple patients within their practice. They'll probably see more of myself, the clinical specialist, kind of maintaining the day to day. I mean, the sales reps are still active in covering cases and all that kind of stuff. But yeah, so I'd say the sales reps first. And then once we kind of get that relationship established, we have some patients with them. There's some, mutual trust. It's the clinical specialist really kind of steps in.
So you don't cover any cases.
No, we do. Yep. So we're the first. So for trials, implants, patient meetings, that's kind of, if we only have, say, one or two cases on a particular day, usually I'll be the first to cover those. And then if we have either more in a particular day, then the sales reps will help cover those extra ones. But if, say we have one or two in a day, usually I'll cover those so that they can focus on building the business. And then if there's days where we have 3, 4 cases on in all different parts of the territory, the sales reps still cover cases and that kind of thing. So it's all kind of like a team effort for sure.
So I'm not trying to beat the dead horse, but I just want to kind of have it all spelled out. So customer X is there. They meet the sales rep. Sales rep establishes a relationship. The customer X wants to, customer X wants to use products, and now a surgery is up on the schedule, and then you're sent out to go cover that case.
Mm-hmm. Yep.
And now, if I want to continue using more and I have more surgeries I want to use it for, the sales rep will take the spillover that you're not covering.
Yeah, I mean, yeah. So essentially it's a day to day, right? So it just depends on how busy a particular day is. So for customer X, they're meeting with the sales rep to kind of first establish those needs, figure out what they're interested in doing. And
Sure.
then, yeah, it'll mostly be me for the clinical, like patient meetings, post-op meetings, covering the case, anything that I can do to help free up the sales rep's time. And then if there's a particular day where there's we have a ton of cases or a ton of stuff going on, and then we're all in cases that day. That makes
Got it. And then, are you close with the associate sales reps as well?
Yeah. So me, my rep and my associate rep, we're on a text chain, all day, every day. I mean,
Oh,
we
wow.
definitely
Okay.
communicate. Yeah, we are definitely in constant communication, which I think is just so key to being able to run our territory effectively, just because how dynamic being in the field can be, and how just on a day-to-day basis it can change, within an hour, within a couple hours, if you get a page or a last minute add-on that no one told you about. And so we're in constant communication all day, me and my team,
Got it.
my reps.
Got it. So, people outside the medical device sales industry, they believe a lot of people are just under the impression it's associate sales rep to sales rep. And this clinical specialist thing is kind of like a big question mark. When you think about your role and how you got into it, and you think about someone that's outside the industry that wants to become, a medical device sales rep, would you advise them to go your route and get into start as a clinical specialist, or would you advise them to start as an associate sales rep, and why would you do either?
That's a great question. I would say it depends on where they're coming from. I'd say if you have no sales experience, like outside sales experience, I think the clinical specialist role is a good way to learn your therapy, learn your devices, learn the ins and outs of everything, establish those relationships in kind of a low pressure setting where you're not held to a number right away. That way you have such a solid foundation. You've already made those relationships so that if you want to make the next step to becoming a sales rep from a clinical specialist, I feel like it's an easier transition. But if you're someone who does have B2B sales experience and you are looking to get into medical sales, I think either the associate sales rep or the clinical specialist role would be a solid position to kind of, start testing out your skills and building that foundation.
Got it. So, as a clinical specialist, is every clinical specialist end goal to become a sales rep, or is there a whole track for just remaining a clinical specialist?
Yeah, no, it's a good question. Just from my time in Medtronic, I've seen clinical specialists go on to be sales reps, and they thrive and love doing it. I've seen
Sure.
clinical specialists that are just content, being a clinical specialist. They get bumped up to senior or principal. And I've also seen clinical specialists go on to marketing or
Okay.
like finance. There's just so many different routes I've seen them go.
Sure.
Really getting that field experience I feel like it builds such a solid foundation for even internal in-house jobs, because you have, in-person experience with our customers, and it's just such a valuable translational skill to have for whether you want to become a sales rep or get in-house in marketing, that kind of thing.
Got it. So if somebody listening right now and they're thinking, I love what she's saying, what are the need to knows for that aspiring individual that wants to become a clinical specialist? What do they need to know going in to make sure it's the right choice for them?
Absolutely. I'd say some of the biggest things you need to know are that you won't know what your day is going to look like until 3 o'clock or 4 o'clock the day before. So you kind of have to be very flexible and have an open line of communication with your team. We're in a therapy where we're very lucky to be very team oriented. There's 3 of us. I know there's some therapies where it's one person covering like the whole Northeast region, not just a small, part of New York State. So I would say you definitely have to not have the 9 to 5 mindset. You definitely do have to just be flexible and always be prepared, always have all your product in your car, because you never know, when you're going to get called away for a last minute add-on or anything like that. So I would say biggest shift from going in-house to the field is just being flexible and just how dynamic your schedule can be, even on an hourly or daily basis.
Sure.
I'd say that's definitely the biggest transition or adjustment for me as well. And so, yeah, just being very flexible and keeping a line of communication open with your team just to really set you up for success.
And would you say that sales reps have a bit more control over their days?
I'd say so. So yeah, they're kind of, at least on my team, they're kind of steering the ship, right? So we'll kind of on our text chain say like, oh, Holly's covering this today. Our associate rep's covering this today. We really just kind of, my sales rep, she steers the ship. So she really not that she has more control, but I'd say she has definitely more autonomy to focus on her sales activities. But with our particular therapy, she is also the first one to receive those on-call pages, I guess. Like if you get a page from our 1-800 Medtronic internal team that says, hey, we have patient X in an ER, an hour away, can someone be there? They're the first ones to take that page. So they definitely do have more control over their schedule, but I feel like we all are part of a dynamic, kind of ever-changing schedule as well.
You all got to be available.
Yes, absolutely.
So let's talk a little bit about what it means to be in pain therapy, because I think it's really cool that you were a customer service rep. So I'm assuming you've seen a whole bunch of therapies.
Yes. Yeah.
Okay.
So when I was in customer service, I did or supported deep brain stimulation, spinal cord stimulation, and then we also have a sacral stimulation for fecal and urinary incontinence.
Wow. Well, please enlighten our audience with what those are and the differences between them.
Yeah. So deep brain stimulation is for our patients who suffer from Parkinson's or essential tremors, essentially any sort of movement disorder, where same kind of thing to spinal cord stimulators, where there's a battery and then there's leads that are implanted into the brain. And we're just basically modulating the nerves there to kind of alleviate their Parkinson's symptoms or essential tremor symptoms. And then with our sacral stimulation therapy, it's the same kind of thing where there's a battery implanted under the skin and the leads kind of target the sacral foramen and really just kind of modulating those nerves to help with urinary and fecal incontinence or overactive bladder, those kind of things. So same kind of thing. It's just where it depends on where that lead is implanted, basically whatever nerves we're trying to modulate. So,
and in these therapies, you're not just seeing the providers, you're seeing the patients too.
Mm-hmm. Yep. Patients have our cell phone numbers.
Oh wow!
We
So
see
the
them.
entire team, or just you, or just the sales rep, or just the social sales rep?
Yep. Great question. So the entire team, essentially, we all, give out our cell phone numbers. So if you're looking at kind of the patient care continuum, so from, the first time they meet with a pain management specialist or doctor to the time they move to implant, we're kind of there with them every step of the way from implant or from trial, if they move on to implant, and then managing that implant like post-op or making any sort of adjustments if their pain pattern changes. So we are with them, throughout the life of their battery, essentially, throughout the life of their therapy.
So as a patient, do I just kind of call whichever one of you is available at the time, or do I know who to call when, or how does it look to the patient?
Yeah, so that's a good question. We have some patients that we have some patients who we have an established relationship with. So we have some patients that always reach out to me, some patients that always reach out to my rep, some patients that always reach out to my associate rep. But then we also have some patients who have all of our numbers and we'll just call until one of us is free and can pick up and we're not in cases or anything. So it varies from patient to patient. We have some patients that text and, do all that kind of stuff. So with that, you really kind of have to sort of help manage expectations. Like if they text you at 9:00 at night and it's nothing super urgent, usually I'll respond the next morning just to not set that expectation of they can just, expect us all hours, 24 hours, day and night. But, you do get those text messages where it is something urgent where you need to alert the doctor or they ended up in an ER. So it just kind of depends on how you triage things and how you manage those patient expectations.
The beautiful thing about this is these patients must feel so incredibly supported to know that many people are working with them to make sure these things happen smoothly.
They have a whole care team.
that has to be very empowering. Talk to us a little bit about that. What type of pride do you take in what you do, and what does it do for you at the end of the day? Is it what you and I kind of want to hear how you saw it before you got in, and now that you're actually there.
Yeah, good question. So when I worked in-house and I got to kind of shadow different therapies from our cardiac reps to our neuromodulation reps, I always knew that I wanted something that had that aspect of direct patient contact or direct patient experience. Because there are some therapies where it's just, like a stent or, something that's
Right.
implanted that doesn't really need any sort of management before or after. Where for some
Sure.
people that works great for them, that is kind of where they thrive. But I did want that aspect of patient interaction because, sometimes as crazy as it is that, patients have your direct cell phone, you do get those texts every now and again where they say like, oh, I was able to, pick up my grandson, or I was able to
Yeah.
walk around the grocery store without leaning on
Yeah,
the
it's
cart. Like
amazing.
it really is a life-changing therapy. So with that, I mean, it's great to have those rewarding experiences, right? Where you get to see a patient come from trial to implant to now they're much more active. Their pain is that was at a 9 is now at a 2, and it's
Right.
very rewarding. Yep,
That is
absolutely.
so cool. So, with all this patient care and attention, and I'm assuming provider care and attention as well, I gotta ask, what does your social life look like? I mean, do your friends your family and friends just understand, or how do you manage expectations in that part of your life?
Yeah, no, that's a great question. So it is spinal cord stimulators and targeted drug delivery is considered an elective procedure. So for the
Hmm.
most part, unless your case gets delayed or something crazy happens, for the most part, you have your evenings. And for the clinical specialists, we mostly have the weekends because our sales reps are the ones who are taking those pages, from hospitals, from ERs, that kind of thing. They're the first kind of line of the on-call aspect of our job, I'd say. So for the
Okay.
most part, I do have my nights and weekends, and my team is great about, if I request time off, they'll pull clinical specialists from other
Sure.
territories if they need for the week. And so I do have a social a social life. It's not as crazy as say like a trauma rep or the other therapies or devices that are in the med tech industry.
Got it. Got it. And so for the last year and a half, it's been a sales rep and associate sales rep, the same people.
So I was with my sales rep has been in our territory for like 15 years. She's awesome. And I got brought on about a year and a half ago, and then we brought on an associate sales rep. Oh gosh, probably like a year ago now. So he just
Okay.
got tested out of training. So now
Okay.
we're a team of 3. Yep. Yep.
So is it like a family? I mean, you talk to these people every day, all the time. I mean, I can only imagine
Yeah.
the relationships that are developed.
Yes. No, absolutely. I have such an awesome team, and I know like your team can really kind of make or break your experience, right? And we all share the workload. We all are just in constant communication about like, whether insurance, comes through for a patient, or I mean, just all the little kind of roadblocks that can happen with getting a patient from trial to implant. We're in constant communication all day, every day, and I could have asked for a better team. So we work great together. We're also willing to, be the first ones to jump in and say, what do you need? Like, what do you need from me? How can I help you? So it's been a great dynamic so far.
So cool. So very cool. Okay, so, you know, talk to us a little bit about what makes a good clinical specialist. You know, you've been doing this for a year and a half now. You have a wealth of experience that I'm assuming so many do not have because you came from the customer service trenches. So you've seen all sides. Talk to us a little bit
Mm-hmm.
about what makes, maybe the top three things that you got to have if you're going to be an effective and really good clinical specialist.
Mm-hmm. I would say the biggest thing that kind of sets a good clinical specialist apart from just a regular clinical specialist is just always being prepared and always showing. I mean, it just sounds like the little things, like showing up an hour before your case, not 10 minutes before your case. I mean, I've talked to some doctors who would tell me about experiences they've had with clinical specialists or sales reps in the past where I think now I'm like, I would never show up 5 minutes before, like, all right, stuff that you just is just so crazy that some people would do. So, I mean, just being prepared always and just keeping that line of communication open with your patients, with your providers, with your team. I think that really kind of, if you silo yourself out, I feel like it's going to make you just not be as effective and efficient as you could be and use your time wisely. So I'd say always being prepared, being a clinical expert on all of your therapies, knowing how to, if you don't know an answer, knowing where you can get it and following up if a doctor asks for something, if you don't have the answer about a contracting question or something like that, as long as you keep that communication open, update them, yeah, that really just kind of, I'd say, time management and communication really kind of sets a good clinical specialist apart from just an average or someone who does the
Got it.
bare minimum.
Got it. What are some of the biggest challenges that are particular to being a clinical specialist that you have had to manage?
Um, I'd say the biggest challenges are just how much your day can change. So, like there have been days where I've shown up for a surgery and a patient had tested positive for COVID, and then it's like, okay, well now my whole day is kind of, not that it's ruined, but I kind of have to pivot and just figure out how I'm going to spend my time. Or I'd say just the biggest challenge is just how dynamic your schedule can be. So just always being prepared. Always, if you know that your case is probably going to be delayed 2 hours, have your laptop with you so you can do kind of the admin stuff, expense reports, training, stay up to date on all that kind of stuff. Because I know some people who will, wait to do that stuff once they get home. But if you've had a long day and that's the last thing you want to do, instead of just sitting around an account for 2 hours, killing time, you might as well utilize the time you have and get stuff done that you need to get done so that you can, enjoy some free time. So just, yeah, the biggest challenge is just all the roadblocks too that come up where if a patient's insurance gets denied and then you have to kind of help with them with providers appealing, patients that test positive for COVID, patients that either just don't show up for their day of surgery or they don't stop their blood thinners or they had breakfast that morning when they shouldn't the day of surgery. So just little things like that can, if you let it get you down and if you let it get, you can't let yourself get frustrated. You almost have to anticipate that things are going to go wrong so that you are either pleasantly surprised or you've got what you expected, I guess.
That's good. No, that's good. That's good. So do you spend the majority of your time in hospitals, in and out of offices, mixture of both? What would you say?
It's a mixture of both. I'd say probably close to 50-50, I'd say. So if we're covering an implant or a trial, we're going to be usually in like an ambulatory surgery center or a hospital setting. And when we're meeting with patients, for their consult, for their post-op appointment, or just like what's called a reprogramming session where we just make some tweaks, those are all done in office. So usually they meet with their pain physician on a fairly regular basis. So if they need us at a particular appointment, our providers are good about emailing us, letting us know like, hey, we have patient so-and-so coming in on this day, are you able to come, that day? So I'd say it's about 50% of the time you're in an ASC or a hospital, and then 50% of the time you are in an office setting, meeting with patients and just kind of, helping them, show them how to use their program. Or like a lot of our older patients are not super tech savvy, and just really kind of sitting with them and walking them through how to turn on their, programmer, how to increase their stimulation, how to decrease. So it's a lot of education comes with it too. So yeah, good question. I'd say 50-50.
That's cool. And when it comes to the actual office, is it namely the provider that you're having the most conversations with? Is it the nursing staff? Is it someone else in the office? I mean, how are you spending that time?
Yeah, good question. So if we're just stopping, like for a patient meeting, for the most part, we're talking with the provider directly, just saying, hey, here's the changes we made. Here's how much pain relief they're getting. Here's kind of a summary of what we did with the patient. And then if we're meeting with his office staff to go over scheduling or any issues that they're having with insurance, we'll meet with like the scheduling, the MAs, the PAs, all that kind of stuff as well, just to kind of make sure that we're all closing the loop on any sort of communication where, what's going on with patient so-and-so? Oh, this is, the last update we got from them, and just keeping that communication open. So for patient appointments, you're meeting with a provider as well. And then if you're just in the area and just want to touch base with their scheduling team, they're also a great resource for us as well.
And are you ever in situations where you need to cover a case with your associate sales rep or sales rep?
Yeah. So big part of training is you have to get a certain number of hours in shadowing. So you do classroom training, but you also do a certain amount of hours of seeing cases, seeing post-ops, seeing reprogrammings, all that kind of stuff. So when we had our new hire, our new associate sales rep on, we did a lot of that where, he would shadow either myself or my sales rep. I'd say it's rare that now that we're all, signed off and trained up, it's rare that we cover cases together, but usually we'll go like a couple times a month and we'll go in, either me and my rep or my rep and my associate rep will go into an account just to touch base with their scheduling team, just say hi, do that kind of just day-to-day catching up with our accounts. Yeah. In terms of cases, we're mostly on our own, but for office visits or just, catching up with the schedulers, we do it as a team.
And just so the audience knows, for those considering this space, how long are these cases typically?
So a trial is anywhere from, we have some doctors who do these all the time that their procedural skills are so great that they are in and out in a half hour or less. We have some trials that take about an hour max if they have a hard time getting those percutaneous leads up into, the epidural space, or if it's a patient that has really kind of challenging anatomy, a lot of scoliosis, a lot of hardware, that kind of thing. And then for the permanent implant, I'd say it takes anywhere from 1 to 2 hours, depending on, how difficult the case is or, how experienced the physician is.
Sure. Now, we're going to switch gears just a little bit, and share what you can. But you've been in this space for a year and a half now. I'd like to believe that you've seen some just moving situations. Could you share with us, maybe a moving situation that just kind of gave you this, wow, this is what I do. Wow.
Moving in terms of like, wow, my job is so crazy. Is that what you mean? Or
moving in terms of maybe the change you made for a patient, like how you impacted a patient's life, and heck, if you have a crazy situation that you want to share with us, that too.
All right. I'd say it was when I first started. We had a patient who he was coming in for a spinal cord stimulator. He had chronic pain for a long time. He was his pain was between an 8 or a 9. And by that was kind of my first patient where I saw his trial and I saw his implant, and then I got to help manage him afterwards, and just seeing how night and day just his demeanor. So when we first met him, a lot of patients, think about it, if you're in chronic pain, you'd kind of be grumpy, crabby, just a lot of patients are depressed and kind of have this affect about them. And just seeing him now, it's just like he just looks so much lighter, and he is in just so much less pain. And he, he sent us a text around Christmas time saying, thank you so much. Like for all the work you do, my pain is now like a 1 or non-existent, a 0. Wow. And he can, chase his grandkids around and do, awesome. Things like that. Yeah. So that was my first patient that I saw from like the entire care continuum, I guess, was kind of my first kind of aha, like, okay, we are, even though it's not a life-saving therapy, it definitely is like a life-changing therapy.
Absolutely. And then the crazy situation that crossed your mind, now you have to share it with us. So give us, now you have to share with us, give us that crazy experience that I know crossed your mind when I initially asked you that question.
Okay. So it was my first case that I was shadowing as part of my training. So I was fresh out of the classroom, had never seen like a trial or implant done before. And I was at this account where it was summertime. It was like 95 plus degrees outside, and the AC went out. Oof. And the OR was probably close to like 85 plus degrees. And they use fluoroscopy for our cases. So there's this X-ray machine called a C-arm that kind of goes around the patient bed, and it allows you to take X-ray imaging during a case. And the first kind of picture or X-ray shot they took, both the screens went black, and there was a big red like alert that said that the C-arm or the X-ray machine was overheating. So their solution was to take 2 ice packs and put them onto the two ends of the X-ray machine to help cool it down. Wow. And I just remember thinking to myself, I'm like, what am I doing here? Like, how did I end up in this role, in this position? But it everything turned out fine. But it was
so it worked.
Interesting. Yeah, I teased my rep that was she hazing me was my first question for
Was
her.
it
So.
right? What
hmm
an experience. What an experience. That is fantastic. So you've seen so much in your role. A year and a half in, and you've already seen so much. Tell us, is there anything you'd like to share with the audience? Remember, our audience consists of people that want to get into the industry, people that are in the industry in different spaces, and people that are leading the way. What would you like to share with the audience if you could just share anything?
I would just say if getting into medical sales or getting into med tech in general, something you really want to do, I would say that you have to be, very passionate about what you do and be kind of all in, because there's so many people that do want to get into this space, and that, you really do have to care, and you really do have to put the patient first. It's so easy for us to kind of get caught up in the day to day of emails and expense reports and back order issues and everything that can crop up on a daily basis. But at the end of the day, just always knowing that there's a patient on the other end of whatever you're doing really helps kind of make it all worth it and make it all, come together at the end of the day.
Beautiful. Okay. We're going to have some fun before we let you go, Holly.
Okay.
And we're going to have ourselves a
Okay.
little lightning round of questions here. And you have less than
Oh
10
gosh.
seconds to answer each one. Are you ready?
Okay. Okay. I think so.
All right. First question. Best book you have read in the last 6 months?
Oh gosh. Best book I've read. I've actually been, over COVID, I was rereading a bunch of books that we read in high school that I feel like we didn't have the mental capacity to understand as
Right.
children. You know what I mean? Like the big, heavy kind of concepts. So rereading like Lord of the Flies, Mice and
Oh,
Men,
wow.
all that kind of stuff. I've really enjoyed kind of going back and doing those. So that I
Both?
don't have a great answer.
No, no, no.
But
Both
yeah,
of
that's
those
what I've.
books are fascinating books, especially Lord of the Flies. That one
Mhm.
is it pulls out, how humanity can work at its core when there's no
Yeah,
law. And it's pretty
and
it's
I
pretty in
feel
depth. I like that.
exactly. And I feel like a 14-year-old, 15-year-old doesn't have the life experience to
No.
like fully understand, those big works of literature, classic literature. So that's kind of what I've been doing.
Fantastic. Okay. Best movie you've seen in the last 6 months.
I It's a movie called Jojo Rabbit,
Okay.
where if I do you know have you heard of it, or do you know what it's about?
Clueless. No idea
Oh
whatsoever.
gosh, so when oh my gosh, when I explain it, it's gonna sound so bizarre, but
You better explain it. Everybody wants to know.
it's basically about like World War II Germany through the eyes of a 10-year-old, and it's
Wow.
I think it came out a couple years ago, but I just recently saw it within the past 6 months. But it's very like endearing and heartwarming, and also that, I mean, it's just it gets you get in all the feels. It's great.
Oh wow. Okay, so now I'm gonna have to check it out. Okay.
Yes, Jojo
Best
Rabbit.
Jojo Rabbit. Got it.
Mhm.
Best meal you've had in the last 6 months.
Ooh, I went to Boston to visit some friends and had an amazing lobster roll. Hot and buttered is the only way to do a lobster roll, not cold,
From where
no cold
you can't
mayo.
drop that. You can't drop
Boston.
that and then not tell us where.
It was called Joe's, I think, Joe's Crab Shack or something,
Joe's?
like, I don't even know. I don't know.
All right.
I'm sorry.
For all you Boston listeners, Joe's, please report back to me if it's as good as she's saying, the lobster roll. And then
Yeah.
lastly, best experience you've had in the last 6 months.
Ooh. Um, Having my family come out to visit and kind of showing them my new home and my new neck of the woods has been a lot of fun.
Fantastic. Congratulations on your new home. Holly,
Thank
it has
you.
been a pleasure having you on the show. We have such an insight into what it means to be a pain specialist, clinical specialist in pain therapy. So it's been a pleasure. Thank you for being on the show.
Thank you for having me.
And that was Holly Frankenberg. I've had pain specialists on this show before, but a particular reason I loved having Holly on the show was because of what she was able to understand, as you heard, before she took the role. I mean, she got a clear understanding of what each person's position means and how they benefit the provider and the patient. And then she got to finally step into it. So you might be listening to this episode and you might be thinking to yourself, That's it right there. That's what I want to do. Maybe you've been wanting to get into medical sales and you've been browsing medical sales podcasts, or you've been listening to this one, the medical sales podcast, and you're thinking to yourself, I really want to live this lifestyle. And you haven't been able to make it happen. Maybe you don't know where to start, or you've been applying left and right, 10, 20, 30 applications, and you're hearing nothing back. Or maybe you're actually getting interviews and you just can't seem to make it past the first or second round. Well, I am asking you now to stop doing what you've been doing that has not been working and visit evolveyoursuccess.com and select Attain a Medical Sales Role and let a team of professionals help you get the position that you deserve, the position that you dream about, the position that you know you were designed to do. Hence the reason why you keep coming back and listening to these episodes. And if you're in the field and you've been having success, or maybe not, maybe you want a little bit more success, or you know that you can be doing more and you're just not quite sure where to get it. Where do I get this extra training? Where do I get this extra insight? You have an understanding of what you're supposed to do each and every day, but you're not quite sure how to make certain things work. Maybe you're stuck in case coverage and you haven't really figured out how to sell. Or maybe you do know how to sell, but you haven't really got your territory to where you believe it's supposed to be. Again, stop wondering, stop thinking, stop wishing things could be different. Take action. Visit evolveyoursuccess.com, select improve sales performance, and let a team of professionals help you make good things happen in your territory, great things happen for your career. You know, we do this because we know that there are so many fields of interest within medical sales that people need to know about. And because people are doing, as you've heard, amazing things each and every day. So make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.